Hey y'all, I'm Kaylee, and I'm focusing on the basic degrees of nursing, such as LPN, ADN, diploma, BSN, and master's. And in my section of the wiki, I expanded on those different degrees and talked about schooling and how long and the requirements and things like that. In my opinion, it's impossible to describe nurses in one word because we are definitely way more than just that. So, in my opinion, nurses are loyal, trustworthy, loving, hardworking, responsible, caring, and I definitely would consider us angels. My personal interaction with nurses has been a lifelong interaction due to the fact that I'm actually a type 1 juvenile diabetic. So I, was in the hospital at 5 years old getting diagnosed. I can remember most was the nurse sitting by my side, pricking my finger for the first time and putting a Band-Aid on, telling me everything would be all right, teaching me how to give shots to oranges, things like that. That reassurance and that helpfulness definitely made me a lot stronger and helped me to mature. And the nurses were always by my side, always helping me with questions and always telling me that things were going to be okay. And it was good to know that I could actually believe what they were saying to me. Some recommendations that I would make to nurses would be more schooling, definitely. You can never know enough. It's better for your patients, better for everyone around you, the more knowledgeable you are, and the more information that you have. Also, as Dr. Hickey says quite often, learn how to say no, because it's dangerous to have nurses that are working off of 2 or 3 shifts in a row. And so in order for not only the nurses' help, but the patients' help, it's essential that nurses learn how to say no.
Hi, I'm Selena, and for this wiki project, I researched job availability depending on what degree you have. So this is where you can work depending on if you have an LPN, a BSN, a master's, or a doctorate degree. If I was asked to describe nursing in one word, I would say caring, even though I don't really think nurses can be described in only one word. Nurses are so much more. They are nurturing and selfless, and they are always there for you. If you ever need a shoulder to cry on or someone just to talk to, they are always there. Unfortunately, I've had good and bad experiences with nurses. The most recent time I was in the hospital for dehydration, I had a bad experience. My nurse did not appear to enjoy his job and he neglected his patients. I ended up having a problem with my IV. It would not allow medications or fluids to enter into my body, and it was imperative that I receive this medication. Although I asked my nurse to come and fix it multiple times, he never came. Another nurse on the hall, who had her own patients, ended up coming and fixing my IV for me. For improvements to nursing, I think that all nurses should have a minimum of 4 years of education. As a patient, I would not feel safe if my nurse only had 2 or 3 years of education. I also think that all nurses deserve more breaks throughout the day. It is important to keep nurses rested and not to make them exhausted. A 12-hour shift is a long time, and if a nurse is exhausted, then they can easily make mistakes.
In Clevenger, and the area of research that I did was on the pros and cons of the degrees in nursing, and I basically composed a list that weighs the benefits and the negatives to the certain degrees available to nurses, and this also helps nurses to decide what level they'd like to go into, whether they'd like to just do the bare minimum or pursue the highest degree that they can get. If I could describe nursing into one word, that's difficult, but just narrowing it down to just one word, I would probably have to pick dedication, because nurses have to dedicate their lives to nursing in order to provide patients with the care that they deserve, and that they just need to dedicate their time, and they need to put a lot of effort into it. So I think that would be like a good word to describe them. I haven't really had many interactions with nurses in my life. I've never been hospitalized, and I don't go to the doctor very often, but my grandparents have been hospitalized before, and the interaction with nurses that I've had when they were hospitalized, it was pretty good. The nurses were really nice and polite, and they treated my grandparents very well. And if I had to go to the doctor and get blood drawn, I had really good nurses to take care of me because I'm deathly afraid of needles, and they just knew like how to handle me in that situation, and I just saw them as very like dedicated, like I said earlier, people, and they were very caring and very sensitive to my needs and my feelings. And I guess suggestions for improvements for nurses, I guess I would suggest to get the highest education that you can obtain, because the more educated you are, the more knowledge you have, and the more prepared you can be. And to never lose that passion, and to always be caring and loving.
Hey guys, I'm Allison and I'm working on the continuing of education for nursing, such as recertification and licensure for registered nurses, so that way we can all keep practicing whenever we pass our NCLEX. And also I'm doing what happens whenever nurses change from state to state. To me, nurses can't be described in one word at all. I haven't had much of interaction with nurses and like as the patient, but as the ones that I have with my internships that I've had and everything else that I've done, nurses are just something that I don't even know how to describe. They are perfect and wonderful to me, even though we all make mistakes. The way that they take care of everyone and can help everyone in each and every way is just perfect to me, and I don't know what I could use to describe them. Um, like I said, I've only had like internships with nurses. I never really get sick that often, and so thankfully I haven't been put in the hospital for anything. For doctor's appointments, all my nurses have all been really funny, and they all just like to talk to me and everything. But with my internships, I was able to see the good and bad side of nursing. Some of the nurses just weren't really into their jobs, and they would just be really irritated with the patients, like if they were just in so much pain and they wouldn't cooperate with everything. Then other ones were just wonderful. They loved their jobs. They loved everyone that came in. They just wanted to help as many people as possible to the best they can. Improvements to nursing would be having more breaks for the nurses, because I notice through the internships that nurses don't really get much time off. At a local doctor's office, they only got a 20-minute lunch break for the whole day, working from 7:30 to 5 in the afternoon, which is a bit long to me, and so I can definitely see where the negative effects hit the nurses health-wise and everything. And also to appreciate them more, because nobody really appreciates a nurse as much because they're the ones giving the shots and everything. Doctors get all the credit for stuff, but nurses are really like there in the back doing everything, giving the medication, like helping the patients with what they need, being there at all times, and that's all I got to say.
I'm Lana, and this is my introduction video for my nursing wiki. My topic is salaries of nurses based on their degree. If I could describe nurses in one word, I would say thoughtful, um, caring, helpful in any way, stressed. Nurses have definitely helped me in the past. I had a broken leg, and they were there checking on me constantly while I was in the hospital. While my grandpa was in the hospital with cancer, they were constantly caring for him, helping him as much as they could to be comfortable as possible. Um, I have had one bad interaction with a nurse. She was very rude, jumpy, but that also comes with the stress of being a nurse and trying to help everybody at one time, so that's understandable. The improvements of nursing, I would definitely say getting more breaks. They definitely need stress relievers, like they need to do group meditation or something like that. That would help them. Definitely keep getting recertified, so that you keep up with all the new and improved aspects of nursing, and just to stay positive with every patient, and don't lose your cool, and always do what's right for your patient. Thanks, y'all. Bye.
Hi, my name is Leslie Ann. For our Group Wiki, I research specialty degrees after becoming a registered nurse. I focus on advanced practice nursing, including certified registered nurse anesthetists and nurse practitioners. If I could define nursing in one word, it would be a friend. I feel that most people who are ill just need someone there to be supportive. I believe a nurse is the perfect person to be that friend in supporting their patients.